I began my practice in 1981, so about 35 years now. And I found that what we teach in the class and in seminars and what happens in practice are not exactly the same, because in seminars one gets the impression that homeopathy is all about like good prescriptions or brilliant prescriptions or great ideas, and if you give that brilliant prescription, then your work is done and everything will be fine later on. It's just like saying, if you find the right person and marry her, then life will be peaceful. Which is not true.
Not always.
That's when the whole problem begins. So, I found that in practice, yes, good prescribing is very, very important. And definitely we must learn everything about case taking, about repertory, materia medica, the contemporary approaches, sensation, Scholten, whatever is available, we must equip ourselves with that knowledge and try to give the best possible remedy for the patient. But that is just the beginning of the story. Practice consists of follow-up. Basically, long-term follow-ups. And there are a lot of things involved in that long-term follow-up, which I think it is very important to talk about. And therefore, for the last nearly 1.5 years, I have been putting my attention on follow-ups, or how to convey what is happening in practice, the reality of practice. For this reason, I identified about 100 patients of mine who have been following up with me for anywhere between 15 to 35 years. And some of them are still coming to me, and some of them have finished with their treatment and they are fine. Some of them are not so fine. So I identified about 100 of these patients and I got them to the clinic, and I asked one of my assistant doctors to record 10-minute video clips of these patients. We have so far recorded about 70 of them. And they speak about their journey with me, with homeopathy, what happened to them, what are the things that they perceive, what are the things they experienced, what did they go through, how did their acute problems get sorted out, what else was needed in their treatment. This is what they spoke in 10 minutes. After recording these nearly 70 patients, then we took out their case histories, case record forms, and we tried to understand what has happened to them over so many years. Did they need the same remedy? Did they have acute issues? How did we handle that? Did we need to change a remedy? What else we needed to do during the follow-ups? etc. And out of all this kind of study, we created a document which I am going to speak about in the seminar. And first of all, I will give a brief overview of the follow-up thing in about 2 hours now. And following that, we will then categorize the different types of cases and results that happened. So let us start. I wrote here the art of follow-up because as much as case taking is an art, as much as remedy selection is an art, so also is the management of the case. It is an art. It is a very artistic thing. It comes from the heart.